protozoal sections. The first protozoa we are going to discuss is the protozoa infecting the GIT. So the most common one is the most frequently asked is Giardiasis. Giardia. So Giardiasis is as we have discussed, it is very much common whenever there is a B cell deficiency. They are susceptible to giardiasis because they don't have a secretory component of IgA. So giardiasis it can cause by foul smelling fatty diarrhea, and it's a kind of malabsorption, intestinal malabsorption, and it can lead to malabsorption of the fat soluble vitamins. It is caused by drinking contaminated water, especially the water having the O side, having the cyst in water, by the especially in the campers and hikers, and on microscopy or on we can see the oocyte, the cyst appear as a ellipsoidal structure or ellipsoidal egg, and the trophozoite. Yes, trophozoite. It is multinucleated trophozoite with a pear shape or flagellated structure on trichromatin stain. So the treatment of choice is, first line treatment of choice is metronidazole. So this is giardiasis. The next one is Entamoeba histolytica, and it can cause flask shape ulcer, and flask shape ulcer. It can also cause hepatic abscess, which is the anchovy paste exudate, having the anchovy paste exudate, and if hepatic abscess, there is a right upper quadrant pain, and it is especially in the developing country, whereas the sanitation is poor system of sanitation, and it can spread by contaminated water, by drinking the cysts in water, and on the microscopy we can see the foamy trophozoites or foamy macrophages, foamy trophozoites means that ant amoeba, E for ant, E for eating, E for erythrocyte. So foamy trophozoites having eating the erythrocytes or the RBCs. So the treatment of choice is And we can also use the carriers or the for carriers or the cyst passers. We can use paromomycin and idoquinol. And the second most important, or in US, that is the Cryptosporidium. In our staining lecture, we have discussed that the Cryptosporidium is the bacteria which is the protozoa which can positive on Zn stain. Cryptosporidium can cause watery diarrhea if the patient is immunocompetent, then it can cause mild symptoms. But if the patient is immunocompromised, like in AIDS, then it can cause severe watery diarrhea. And for Cryptosporidium, Zn stain, and they lines the brush border of the intestine, and then it can cause by contaminated water, by oocyst ingestion, and the treatment of choice is first preventing or filtering the water prevention, and if it is not helpful, then you can use nitrexamide. So this is the protozoa causing infection of GIT.